What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watched the video, maybe even liked it, subscribed, I appreciate you. And welcome back. So today I want to talk to you about something, and I'm asking you all to indulge me. So this video may be a little longer than you are used to from me. And the reason is because I've been getting emails in regards to individuals who are at the early stages of their prostate cancer journey. And they're not quite sure how to handle it. And there are a number of us that have already been through this process. And so I'm asking you all to help me help them understand how to go through this process. I believe as I looked through the internet today, I was just trying to see whether or not this was an issue that had been discussed at length. Now, I normally tell only my story, so it doesn't matter, but I decided to look. And what I saw was, there were a couple of females who were actually, they were professionals and doctors who were giving information about how individuals should deal with prostate cancer. And I was thinking, us as a community and those individuals who've gone through this, we could probably provide these people with a little more information in regards to that, and to let them know that their reaction, whatever it is not abnormal. So I'm going to start. I'm going to ask you all to kind of chime in as you see fit. I know that it's freeing. If you can think back to the outcomes, thinking about the outcomes you have now, if you can think back to how you felt then, you'll remember that, you were in a different circumstance then. And so that person, whoever it is that we are meant to help, is probably in that circumstance, and maybe we can provide them some perspective. So I'll go first. So when I walked in the doctor's office that day after my MRI and my biopsy, well, initially there was no way that I thought that I had prostate cancer. Now, I knew I had a history of that in my family with my grandfather, and I knew that I needed to check it. But even my urologist was like, my PSA had gone up to 3.4. They gave me some antibiotics, and it had went back down to like 2.7. Now, keep in mind, there are any number of reasons that your PSA could rise. And so with that in mind, you could have an infection, you could add sex, you could add any number of reasons why that PSA was higher than normal. And so with the antibiotics and it going back down, they were like, look, it'd be going up if you had anything. That's what he told me while I was waiting. And that biopsy to results wait is excruciating, gentlemen. It is sometimes 2 weeks, but it seems like an eternity. My brain was mush. And I'll say to you that, sometimes when you're taking medication, they say, hey, don't make any decisions or anything like that. Don't make any decisions during that 2 weeks. I'm just telling you that you are not in your right mind, especially if you think, even if you think that nothing's coming back. It's just not a good, just take that time to kind of try to stay centered as much as possible. At least that's what I did. Now, when he walked in and put his head down and told me that I had prostate cancer, I heard him. I did. And then my whole body went numb in a way that I had never felt before. And so as he continued to talk, I remember that he said, and you're young and this and that. But specifically, I can't tell you what happened. It was not that I broke down. It wasn't crying or anything, and not that there was anything wrong with those type of reactions, but man. And so he was like, you're 3+4, and I didn't have any idea what the Gleason score meant at that time. I didn't know that 3+4 was right in the middle and that it was early, and I think he was trying to tell me that, but I didn't hear that either. And it's okay, whatever reaction that you have in there, because there's a multitude of things that are going to go through your brain. First, your health, then whether or not you're going to live, and your family, and your job, and what all this means, and then the outcomes that you've heard so much about. All of that stuff comes into play, and it starts punching your brain from all types of different places. And so I was numb. And I said, okay, and I did not make any decisions. I didn't say I was going to do anything at all. Just kind of left. And then I met with the radiation oncologist and looked at what those options were, looked at active surveillance, and then I went on the internet, and I started looking all over the place for stuff for people who had prostate cancer. And it was weird to say, because I never thought that I'd actually get it. And the fact that I had it, and I was now saying that I had prostate cancer, it made me feel weird just typing it into YouTube. And I looked all over the place for somebody just to give me a real and raw understanding of what they went through. And it's very difficult to find, like, a real idea of what was going on. I only found one person. I found a lot of doctors, which made me feel uncomfortable sometimes. I was just like, you're a urologist and that's it. But, I'm looking for somebody to tell me what it looks like when you have it. And it was tough to find. And so even with me doing these videos, I continue to say that I was blessed because Mark's prostate cancer was there. And he put that information out, and it helped me figure out what was going on. And I said, if I ever was able to do this, then, if I got through it and I was blessed, then I would do the same from my perspective. I'm a little different than he is. And so I figured that I could give you a different perspective. But I will tell you that nothing prepares you for that. And it's even worse when you are hoping and wishing that it's not true. Now, at some point, you got to get yourself together to say, hey, you know what? I got to deal with this, but I'll tell you that it's okay to not be okay. It's okay not to be okay. And if you have to retreat and whatever it is that you have to do to understand, because the one thing that I understand, and I want to make sure that I put this on video is that my response to finding out I was 3 + 4 = 7, and later finding out what that meant, could not possibly mirror some of the other numbers that go on the other side of that plus sign. Because once you figure out what that Gleason score means, you know what that plus sign means. And as soon as you understand what that plus sign means, you understand how bad it is. And that's where you get into some difficulty, gentlemen. Because when you start looking on the internet, and I 100% think you should look at whatever it is that you can to get as much information as you can. But when you start looking at that, just know you're going to start to get a clearer picture of where you are health-wise. And it may or may not be something that you want to see or hear. But understand that until you get a fuller picture of what that is, don't think that it's bad, because a lot of people live after being diagnosed with prostate cancer. It is something that you can, that they can do a really good job of making sure that you get through. It's not for everybody's circumstance, but for those that are caught early or those situations, they have a really good process for making sure that you live afterwards. Now, there are outcomes that come with it, negative outcomes. But you are alive and you are here and you are able to continue to live and grow. Right? So, it's not, oh my gosh, this is the worst thing in the world that happened to me in regards to some of the other types of cancer, in comparison. But at the same time, that don't make it any better, right? Don't make it better. Like, oh, well, I just have prostate cancer has never probably been said. And I want you all to understand that as this continues to go through, I want you to know that it gets better in your mind and then worse in your mind and then better in your mind and worse in your mind. It is a constant roller coaster of emotions. You're like, hey, I got prostate cancer. Oh my gosh. Boom. You're going all the way down. And all of a sudden you're like, woo, they got the prostate cancer out. What a blessing. Then boom, right back down. Because you're like, oh my gosh, here comes the outcomes. So just take a deep breath. understand that you control how you feel about this. There is nothing that is happening to you that you can't mentally say you can control, because you control how you see it, you control how you deal with it. But I'm not going to tell you it's easy, because that is not true. It is tough because you are looking and there are so many things that you're thinking about that could cause you some issue. Now, this video is a little longer than the others because some of you, when you were in there, you just want to hear somebody kind of pour their soul out in regards to this. And I know, because that's what I was looking for. And hopefully when you get to this point, you'll understand that I've broken this down into some other videos. Please go to the comments. I have all the faith in the world that our community is going to stand up and say, look, when I found out this and this and this and this and this, and you'll get a perspective on how some of these individuals figure this out. And if you feel comfortable, share your Gleason score, please. Because that's how those individuals can kind of make a connection. Because if you don't tell what your Gleason score was, then they don't know necessarily whether or not your journey is their journey. So please share your Gleason score. Mine was 3 + 4 = 7. I ended up doing the radical prostatectomy. I ended up having some incontinence issues, but not as bad as others. I ended up having some ED issues early. They've gotten, it's almost non-existent at this point, but, you know, these things continue to go on. But I'm just letting you all know that as far as this journey is concerned, it's continuous. As I tell you that I don't have an outcome one day, I may have that very outcome the next day. I did end up having some pain at ejaculation, or nothing comes out, but I ended up having a sharp pain underneath that I had to talk to my doctor about. And so there are outcomes and things that happen during the surgery. Just make sure you make an informed decision, and we're all here for you. All right? I hope this finds you well. Peace and blessings, fellas.